at HAP's annual Quality and Safety Summit last year, a guy from the National Research Corporation, Ryan Donohue, shared about a research project that he was doing that had taken place over several years. He had interviewed thousands of patients. He shared lots of statistics, most of them a little surprising, and probably the most surprising of all was that if given the choice, 38% of patients would choose to go to Walmart to get an MRI if they could, based on the perceived cost and convenience. So for all of us coming from the conventional healthcare, how does it feel to hear that? And now that we know this, what do you think we should do with that information?
Well, this is Tim. I wouldn't go to Walmart for my MRI. I think what it reflects is, I think, is a mismatch. I think in at least the perceived values between the patient and the healthcare system. I think for patients, what is really critical for a lot of situations is access, cost, accessibility, and those are critical factors. It's really hard to perhaps kind of look, if you start to view it as a commodity, really hard to say, is there a real difference between what I would get at a Walmart versus what I would get at another situation. And frankly, there are some cases where the differences in quality across the spectrum of diagnostic testing don't have significant impact on the patient outcome. There are other areas where it's a critical difference, and it could, it makes a lot of sense, determination where you're going to go to get your testing. That is, I think, very difficult for a lot of patients to understand. And I think there is that, conversation needs to be had with the patient when they're looking at, where am I going to get my health care provided, including my diagnostic testing. Part of that discussion needs to be, what are the factors that need to drive that patient decision? With these high deductible plans, we're seeing more and more patients that are being asked to make these types of decisions, and there is not a lot of information available to help guide them along that pathway. Is this a test that I really need to go to one or two sites in the area that do this well, or is this a test that is pretty standard across the board? It doesn't matter where I go. So I think it reflects a lack of education on our part. I think it reflects kind of a growth in consumerism that we're seeing in healthcare. And I think we need to make patients aware about, what are factors that need to be considered in making those decisions at the appropriate time.
And I think that that patients are more in tune now. They will get on their phone or their computer and say, this colonoscopy has a good rating at 3 hospitals, and this one is the less expensive, and my insurance will cover it more, so I'm going to go there. And so I think that there's some merit to what people are saying, and it's our job to point them in the direction, of what would be the better place for them to go and why. If Walmart had standards that were equal to a hospital system, then it might be okay for them to go there.
And I think we have to be careful about reading too much into this. So we have to, I think Tim hit on the issues of cost and access as major drivers. So we need to separate the issue of the physical device from the expertise. If Penn State were to place an MRI instrument in Walmart and own and be responsible for it, and then using digital technologies transfer for interpretation the images back to the mothership where all the expertise is, I don't think anyone would necessarily say that's a problem. So I think, as Tim said, what's being talked about here is probably convenience, access, cost, and not necessarily at what point they would give up on quality.
Well, yes, but I think also that, there are a couple of issues here. One is that people don't always have much choice, not just in emergency situations, but, if you're trying, say, to get a colonoscopy just finding someone who will take you is an issue. So you may not have much choice about quality or service. And then the other point that I would make is that, the idea of the patient as customer, and that's something that sort of, strikes a chill into the hearts of most healthcare providers. But customers are treated with respect and consideration, and especially consideration of their time. And that has been very lacking in healthcare. So that's what people are complaining about, that they have to spend, if they want to go for an appointment, it takes at least a full morning with a lot of inconvenience and perhaps pain if they're a disabled person. And they may not get the results that they went for. It may not achieve their goal, and it may cost an exorbitant amount. So to go someplace like Walmart where it's convenient and you know what you're getting is very appealing. And I think that's something that with the that's why some of these big players are starting to come into medicine, and I think that will probably change the whole scenario of medicine and how people get access to it.
And I would say it's just not about sort of testing. It's also about, sort of the touch and feel and sort of the art of medicine that we've lost over time, and how much time does, the doctor spend with you in talking to you, listening to your story, and touching you and doing an exam. I mean, how many stories have we all heard about patients who said, well, the doc never even sort of examined me, and I got a bill for like $500. Or something like that, or talk to me for like 2 minutes. Then we've had stories where patients have been admitted to the hospital for like 2 weeks and nobody's touched them after the initial assessment. So I think we're losing that kind of, in healthcare, we've sort of lost that touch and feel and listening to the patient's story, which is why we're having so much of unrest from the patient community.
I think it represents this kind of trend towards a commoditization of, as healthcare becomes more and more fragmented, less and less personable, and less aligned with what the patient is value, it really then drives down to a commodity. And we have to be very careful about that, because I think it's problems then about quality and other factors that are not well communicated get lost in the discussion. And ultimately, it really becomes about price, and oftentimes that's not in the best interest of the patient.
Yeah, and I would agree that quality and safety are two elements, particularly when it comes to making a good diagnosis, because you want to know that you're working with an entity that you know has good services and are bringing you the correct results, so that your patient ends up with a correct diagnosis or and the correct treatment plan.